guess I make a lot of people mad when I say that we could teach a monkey to do surgery. It really is just a technical skill. The art of being the doctor is deciding what's the appropriate treatment to do for any given patient with any given problem. So here is a patient who had been seeing his dermatologist for a year, trying various very painful treatments to get rid of his warts. And while they were better, after a year, he came in and said, I just want them cut out. So here is something you haven't seen me do on YouTube before, and I am actually excising the warts, and enjoy the video. I don't do, I think probably the best thing to do is I'm going to have you bend your knee and roll it to the outside. There you go. I don't often do the cutting out of the warts. People are like, how come all these other doctors take the warts out and you don't? And it's because normally I don't need to, but in your case, given what you've been doing, I think it's reasonable to go ahead. Oh, the other thing, Cassie, that I need is the phenol and a couple of cotton-tipped applicators.
How many subscribers do you have?
162,000.
Holy shit! What's sorry? What's your YouTube name?
Dr. Nail Nipper.
Here we go. First. Oh my God, Ram's one now. What?
Oh, you're gonna love that one. Go look after. And then I just need 3 inch. Thank you. Oh, hey there.
Yeah, I actually didn't mean to click on it.
That's
Are you? I find YouTube so interesting. Are you monetized through YouTube? That's awesome. That's a really nice.
It's very difficult though.
Is it?
And it's very arbitrary. So we'll put up the same video twice in the same day, one for members and one for the public, and one will get monetized and one won't.
Interesting.
So it's very arbitrary. Okay, so what we're going to do, we've already injected here with some anesthetic that has epinephrine in it, and the epinephrine is what turns the skin white because it's constricting the blood vessels because warts bleed a lot. That's what all the little black dots are little capillaries. So I'm just going to check first. Anything that feels sharp here?
No.
Okay.
On the outside a little.
Over here?
Yep.
Okay, how about right where the wart is?
No.
Okay. So we talk about cutting these out, but the truth is what we do is we just bluntly separate it from the skin around. You let me know if this is hurting. You'll feel pressure, but you shouldn't feel anything that's painful. So these can just bluntly be separated from the skin around them. Is that hurting? Okay. And we say that warts are encapsulated, so they form this little shell around themselves, and that's what I'm just separating here from the good skin. And it's really interesting when we take it out, you'll see that it's all just self-contained, and the underside is kind of this white, pearly appearing kind of skin. Okay, so again, I'm not using anything sharp, no scalpel here. And see how that just kind of separates itself away from the good skin. And then we can just kind of come underneath it. And grab it. So I don't know if you can zoom in on that. You see how the bottom of this shows that it's all very well contained right there? And that is the actual wart. Did you want to see what I'm talking about? Don't touch it. That's the undersurface that was at the bottom of the skin. That's what you saw. All right, so that's one. Now, if we didn't use the anesthetic with some epinephrine in it, these would be bleeding like stuck pigs. Just because, actually I've never stuck a pig, have you? No. But they'd be bleeding a lot because there's lots and lots of little vessels. And when the anesthetic wears off in a couple hours, you'll be home with this elevated, and that will help stop the bleeding. So it shouldn't be too bad. But again, can you see we're just separating it from the skin around it. Nothing sharp. And there's the whole wart right there. I don't have a scalpel blade here, so I'll just do that. And again, got the top and the bottom, and then the last one is much smaller. It's this little one right here. Even the little ones have that nice little pearly, shiny appearance on the bottom. So it comes out like a little plug. Now, then what I have to do is we have to now use something a little bit sharper, and we're going to scrape the bottom here to try and get out any more wart cells. Because even in the best of circumstances, this, in my hands, works maybe 50 to 60% of the time. But this will give us a good start so that when you come back, if we have to freeze it or something, it'll go much more quickly because we got most of it out. And then the last one right here. You doing okay?
Yep.
Do you need me to lay you back? No? I'm looking a little pale there for a minute. I'm going to just apply a medication at the base here that'll kind of cauterize it off a little bit. Is that your phone? In another room, if you can hear it. Oh, funny. I'm just gonna clean it off with some alcohol here. And then we're gonna put just gonna put a little antibiotic cream at the base of each one of those. And this will be kind of sore for a few days. If you notice that it's starting to get red or swollen or more painful instead of less painful, I want you to call me right away, because those could be signs of infection. And because this is going to bleed a lot, when it all wears off, we're going to wrap it with some gauze instead of just putting a Band-Aid on. That, my friends, is how we excise a wart that we don't want to just treat with freezing. Okay, and we're good. Thank you.